No. Let me seize this opportunity to welcome our fathers in the profession, our eminent professors, our consultants, and especially also our guest speakers, that are already with us. So I want to assure us that this program is going to actually start on time. So we are really very grateful. So we're still waiting for the moderator and some other members to join, but we still have some 30 minutes before 4 o'clock. So thank you very much, Saz and Mas. The moderator has just joined us now. So, and I want to also welcome him, Dr. Gwengadebayo. You're very much welcome, sir. You are probably muted.
Good afternoon, sir. I've seen it. Good afternoon, sir.
Thank you very much. And before we start the formal meeting, I also want to say that we have some members of the Board of Trustees of the Nigerian Academy of Medicine that are actually with us. We have the chairman of our Board of Trustees who is with us. He will be formally, introduced later. But I must welcome Professor Tolu Odubemi. You are very much welcome, sir. He's the chairman of the Board of Trustees and former Vice Chancellor, University of Lagos, former Vice Chancellor, Olusegun Agagu University. So, and so many others. So you are very much welcome, sir. We also have a member of thank you, sir. A member of the Board of Trustees is also already with us, and that's our mentor, Professor Sonny Deboda. So you're very much welcome, sir. Sir, you are muted. So you are muted, sir, so we can't hear you. Okay.
Sorry. Are you hearing me now?
Yes, we can hear you, sir.
Okay. Good afternoon, Professor Ogunbodede. Thank you very much.
Thank you, sir. Thank you, sir. So we also have with us one of our guest speakers. He's already with us, and that's Professor Bola Dalema-Kpayi. Professor Makpayi is, the moderator will introduce her later, so don't let me say anything other than to say that, she's an eminent psychiatrist, a woman of many parts. So
thank you very much, sir. Thank you, sir. It's a pleasure to be here. Good afternoon, sirs.
Thank you. So we have quite a number of our members of the Nigerian Academy of Medicine who are already with us. So we have Professor Odunupe is already with us. We have Professor Isa. So we have, I think, Professor Jewusi. So many other people will be joining later. But we have okay, so I'm also happy to announce that Professor Adesegun Fatusi who is the current Vice Chancellor of the first medical university in the country. That's in Ondo. So he will be eminently introduced later by the moderator. So he's already with us and is one of our guest speakers. So, and somebody who actually played a leading role in putting together this webinar. So thank you very much, Professor Fatusi.
Thank you very much, sir. It's a great pleasure to be here, sir. Good afternoon, sirs, and good afternoon, ma. Thank you, sir.
So, and then we also have with us somebody who is a general. So, and so who is supposed to, so, and somebody who played a very, very prominent role in facilitating this webinar, a member of the webinar committee of the Nigerian Academy of Medicine, General Shino Gubi. You're welcome, sir.
Good afternoon, sir. And good afternoon to all our panelists and the board members here present. We are all looking forward to a very successful webinar today. It's indeed a pleasure. Professor Fatusi, good afternoon, particularly to you.
General, and it's good to see you, sir.
Thank you very much, my VC.
So we are assured of a very successful webinar because the chairman of the occasion had also joined us. You know, we were worried because it was outside the country, but I mean, we know that he would actually be with us on time. And that's the former Minister of Health of the Federal Republic of Nigeria, also a foundation member of the Nigerian Academy of Medicine, Professor Isaac Folorunso Adewale. You're welcome, sir. You are muted, sir.
Thank you so much, sir. It's my delight to be part of this important webinar. And I think the first in the history of academy.
Thank you very much, sir.
Thank you so much, Professor Gumodede, for putting it together.
Thank you, sir. We also have with us now our indefatigable secretary, who is a man of many parts. So he's with us, and that's Professor Oluwole Atoyebi. So he's the secretary to the Nigerian Academy of Medicine, and it's been quite wonderful in putting this together. So Professor Atoyebi, you are welcome, sir. So, and he is also the host, you know, for this particular webinar. You are welcome, sir.
Thank you very much, Chairman Webinar Committee. But you are now co-host, and I will change you to host subsequently.
Okay. No, I think I'm okay with co-host. So thank you, sir. So we still have some 5 minutes before 4 o'clock.
Professor Gumede, sir. Other speakers are in. Professor Adeshola Olumide is also
okay,
online
yes.
already.
Okay, thank you very much, VC, sir. So we have Professor Adeshola Olumide, one of our guest speakers. So we are very much glad to have you, you know, with us. So
thank you very much, sir.
So we want to benefit maximally from your wealth of experience, and we are glad that you agreed to be the guest speaker at this particular webinar. So we are indeed very grateful.
Much, yes, thank you very much, sir. It's a pleasure, sir. Thank you.
Cha, cha, cha.
We are still waiting for one of our guest speakers. And that's Dr. Ejike Oji. Exactly 4 o'clock now. And so maybe we have to give some 2 or 3 minutes. So it's 5 minutes past 4. And I think we should start this program formally at this time. So we want to welcome each and everyone. So okay. The president of the Nigerian Academy of Medicine, Professor Emeritus Samuel Ohagulam, has been able to join us. So we really thank you, sir, for being part of this. So I think we can start the program formally. We want to call on the president to give an overview of the academy and then the objectives of the webinar series. But in the meantime, I have mentioned before that we have the chairman of this occasion, the former Minister of Health of the Federal Republic of Nigeria, Professor Isaac Folorunso Adewale, is already with us. We have our moderator, Dr. Gbenga Adebayo, who is the CEO of Living Health Lagos. So he's also with us. Then we have our eminent guest speakers. They are all with us. We have Professor Adesegun Fatusi is already with us. We have Professor Bola Dalema Kpayi. So he is already with us. We have a very, very revered professor, Professor Adeshola Olumide. So she's already also with us. And then we are waiting for Dr. Ejike Oji, who has actually confirmed that he will be joining us. So I want to request our president, Professor Emeritus Samuel Ohagulam, to
I'm here. Dr. Ejike is here.
Yes. Oh, okay. So you're very much welcome. So thank you very much for being part of this and for accepting to be a guest speaker. So you're welcome. So we have all our speakers. So everything is set. So Mr. President, sir.
Everything possible to ensure that they grow and mature to be good adults. And I must commend the Nigerian Academy of Medicine for choosing this as the first topic for their webinar, because to me, it says that they understand the importance of adolescents and adolescent health. Now we have the framework on the screen. This is a framework that looks at adolescents, not just as adolescents, but also takes into consideration the fact that many things have influenced who they are in their adolescent years. Different experiences they have had during the preconceptual phase, during the prenatal phase, experiences that their parents have had, experiences they also have had during their early childhood phases. All this contributes to who the adolescent that we are seeing now is. And so even as we emphasize the importance of doing everything possible to help an adolescent to grow and develop well, it's also important to pay attention to their early childhood days and even to adults as well, because adults are the ones who are going to get pregnant, have children, and go on to have, who go on to become adolescents. And so at every stage in life, it's important that we have meaningful engagements, we have meaningful interventions that are all geared towards ensuring that the adolescent grows and matures to be a healthy individual. And so we also know that the adolescent does not reside in silos. No individual actually resides in silos. And so for adolescents and adolescent health, contexts matter. Contexts just mean the environment in which an individual finds himself or herself. And so for the adolescent, the family context is very important. What kind of family is this adolescent growing up in? The immediate environment is also very important. The neighborhood, the school that the adolescent goes to, and for adolescents who are working, the work environment is critically important, because within these environments, you have risk factors and you have protective factors that can either make or mar the adolescent. We also do know that no adolescent grows up in a perfect situation. you don't have an adolescent who grows up in an environment where there are no risk factors at all. But what adolescent program has tried to do is to address the risk factors and try to boost the protective factors, all with an aim of ensuring that this adolescent grows and matures to be a healthy and a responsible adult. Now, looking at adolescent health in Nigeria, we know that many times people view adolescents as healthy. Everybody thinks that the people who are vulnerable are under 5s and pregnant women. I must commend our chairman for the work that they are doing in obstetrics and gynecology with pregnant women. They are critically important. We have seen now that experiences that a woman has in pregnancy also do have implications for the adolescent, for that baby when the baby becomes an adolescent. And so because people generally view adolescents as healthy, you don't have as many programs for adolescents as you have for under 5s or as you have for pregnant women. But we thank God and we thank all our elders for what they have been doing, that things are beginning to change, and gradually our government, and indeed the global government and global community, is starting to recognize that adolescents do need health services, adolescents need attention, and adolescents need to be helped to grow and to mature to be responsible people. So the health problems for adolescents typically are described under the things that cause morbidity, the things that cause ill health for them, the things that make them predisposed to dying early, and the risk behaviors that they engage in. This is a period in time when people are more likely to initiate risky behaviors. And we know that many of the illnesses and many of the chronic diseases that show up in adulthood have their origins in risk behaviors that were adopted and initiated during the adolescent ages. And so if you think of something like lung cancer, for instance, many people initiate cigarette smoking during their adolescent years. Many people also initiate alcohol drinking during their adolescent years, and then this goes on to affect their health in future. So very quickly, I'll take us through some of the main health issues that adolescents have to set a stage for what the other speakers will be speaking to. And so many of their main health issues include things like early pregnancy and childbirth. These are still a problem in our environment. Even though we do have laws about early marriage, we still find out that we still have a number of adolescents and young people getting married before the age of 18 years, and this predisposes them to poor pregnancy outcomes. HIV is also still a problem among adolescents, even though antiretroviral drugs are more readily available now. We know that adolescents are the age group that are least likely to comply, least likely to attend clinics, least likely to use those drugs and to use them consensuously. Adolescents are also affected by other infectious diseases, by mental health. My colleague, Professor Makwayi, is going to speak extensively about mental health. By violence, things like alcohol, tobacco use, and other drugs. Injuries are also problems that adolescents face. Malnutrition, both extremes, undernutrition and obesity, adolescents face this as well. And then issues of exercise and nutrition are also examples of health issues that adolescents face. Now, these health issues, we might all say, have been around for as long as we can remember. I mean, I remember in medical school being taught about these health problems as well. However, for the current and the present day adolescents, their experiences and the ways in which these health issues are played out in them are compounded by the fact that we have electronic media, we have social media, now we have artificial intelligence, and this really affects our adolescents much more than adolescents that were growing up at this stage 10 years ago or 20 years ago. In addition, issues like conflicts and humanitarian emergencies are on the increase. And so this places our adolescents at higher risk of negative behaviors and of poor health outcomes. Looking through some data quickly, data shows us that indeed the death rate among adolescents is on the increase. It is much higher among males than among females, but generally it is on the increase, even though these broad declines are slightly different in slightly different groups. We have adolescents who are more vulnerable compared to other adolescents. Now, looking at the top 5 causes of death among adolescents, we find that this differs slightly when we are looking at male adolescents and looking at female adolescents, and when we are viewing younger adolescents as opposed to older adolescents. For the older adolescents male, road injuries and violence are very common when it comes to causes of death among them. And for females, maternal conditions are one of the 5 top causes of death among female older adolescents. Some of the causes of disability adjusted life years, some of the causes of morbidity among them. For male adolescents, meningitis, iron deficiency, anemia. For female adolescents, iron deficiency, anemia, diarrheal diseases, sickle cell disorders, road injury. For male adolescents as well, similar to the 5 top causes of mortality, the 5 top causes also of disability include road injury and interpersonal violence. And for females, maternal conditions, iron deficiency, anemia, diarrheal diseases, malaria, and tuberculosis are the top 5 causes of disability adjusted life years among older adolescent females. When we look at the sexual and reproductive health problems that adolescents have, things like high birth rates, about 98 per 1,000 females, looking at the proportion of women aged 20 to 24 who were married or in a union before age 18 is about 30. Looking at the proportion of males who consider that it's okay for a husband to hit or to beat his wife, it's also quite high. In our environment, many times, even women themselves are sometimes the custodians of the norms that promotes violence against women. And so these are some of the issues that our adolescents face. Female genital mutilation also is still quite common in our environment. With HIV and AIDS, we know that even though the prevalence is on the decline because of ready availability of drugs, you still have this as a problem among male and female adolescents for many reasons. Adolescents are vulnerable, they don't have as much earning power as adults, and so they are more likely to be exploited. And also for the males, you have, while females have more contacts with the health system compared to the males, you find out that many times, even though you have more females having HIV, they usually have better care because they can access care when they are pregnant, they can access care at other points in time when they're taking their children for immunizations. And so we find out that men could be at risk when it comes to accessing healthcare, including care for HIV and AIDS. Other health problems they have, looking at health risk factors, we have seen that the trend in underweight on the increase as well. The economic situation in Nigeria is not making things any better. It's still difficult for many people to have 3 square meals a day. And many times, if a family has to choose an option to choose between giving an under 5 or an adolescent the last meal in the house, that meal will probably go to the younger adolescent or even the father, the younger child, sorry, or even the father in the house. Many times adolescents also have to struggle and have to work so that they can augment family income. Also for underweight, we find out that it's also a problem in our environment. Underweight remains a problem in our environment, even though it looks as if it's slightly reducing, but it is still a problem. Overweight also is on the increase, even though on the whole, we still have more cases of underweight adolescents compared with overweight adolescents. However, we do need to start to look out for overweight and obesity in our adolescents because this is also becoming on the increase. I talked about substance use earlier on. Cigarette smoking and alcohol use, that is still a problem among our adolescents. However, in addition to the traditional drugs that we have always known, there are newer substances that our adolescents are also getting hooked on, so to speak. And so now these days, you have many adolescents and young people being attracted to shisha, which is the water pipe. A lot of them think this is a socially acceptable thing, and many of them go to clubs and actually, as a group, smoke shisha. You also have a lot of other things, other concoctions that they put together, whereby you really don't even know what exactly is it that this adolescent is taking. Previously, if you had an adolescent taking a bottle of beer, everybody knows it is beer, everybody knows it's alcoholic. But these days, when they mix everything together, you just find a young person holding on to one bottle of Coca-Cola for 3 hours, 4 hours. That should make anyone suspicious that might not just be Coca-Cola. It probably is a concoction of other things. Many of those substances which have psychoactive effects on the adolescents and can affect their mental health. Violence is also a problem among our adolescents, and also things like marijuana are also problems among our adolescents. Looking at suicide and mortality rates, many times we say that Nigerians are the happiest people on earth. With the number of adolescents I've seen now who struggle with academics, who struggle with self-esteem, who struggle with even having friends. I have had reason to question the fact that, are we really the happiest people on earth? Or is it that we are just very good at hiding our inadequacies, hiding our depression, hiding our frustrations with the system? And so we have suicide, attempted suicide, suicidal ideation and thoughts being on the increase among our adolescents. And many times when I have reason to speak with vice chancellors, professors, people in the Ministry of Education, I keep telling them, please help our adolescents. They work so hard to score reasonable enough JAMB scores. However, at the end of the day, many of them don't get taken into university. And this is one of the main issues of depression, anxiety, and attempted suicide among our adolescents. I'll leave the details of that to my colleague, Professor Makpai, to talk to us about. Now, what then are the prospects? What are the things we can think about for the future for adolescent health in Nigeria? I would like to discuss this very briefly under 4 different categories, looking at service provision, looking at training, looking at research, and then also closing with the importance of having communities of practice for people who align themselves with the vision of having healthy adolescents in Nigeria. With respect to service provision, our government has done a lot. We do have a lot of guidelines. We have a lot of manuals. We have a lot of protocols. We have a lot of guidance as regards how adolescent health should be provided in healthcare settings. Adolescents typically would access healthcare in hospitals, in health centers, primary healthcare centers, tertiary hospitals, private GP centers, and more recently online. And so we have a lot of guidance documents that can help service providers to provide better care to adolescents. Looking at what WHO has also done, WHO has emphasized the fact that services for adolescents must be accessible, they must be acceptable, they must be appropriate, they must be effective, and they must be equitable. If we think of what our healthcare system is like now, I'm sure we can put a question mark behind every single one of these objectives, because we know that health services are not accessible to even adults. And we can know from that that the situation for adolescents is much worse because they do not have as much earning capacity as adults have. And so it's important for us to do everything that needs to be done to ensure that we fulfill all these criteria for adolescent friendliness. Even when services are free, the types of healthcare workers that our adolescents sometimes come in contact with is enough to discourage them permanently from accessing healthcare. And so we are grateful that our government has guidelines in place. It is important that those guidelines move from the shelves to the very points of care where people interact with our adolescents. We are blessed because we are a generation that is seeing a lot of digital technologies. And so it's important for us to tap into the potential that is provided by mHealth. It's important for us to look for innovative ways of financing adolescent healthcare, because really often they cannot pay for these services. And sometimes when government says these services are free, they are then given a long shopping list of investigations they need to do, of drugs they need to purchase. And so yes, they have been told they have an STI, they have been told they have malaria, they have been told they have some other condition or the other, but the cost of doing the investigations is usually beyond them. And the typical adolescent will just pocket the prescription in his, put it in his pocket or his hand or in her handbag and go off and ask her peer, what did you use when you had the same condition? And so we have a lot of adolescents who are prescribing to themselves, prescribing to their peers, and at the end of the day, they are not properly treated. We also need to improve current services, minimum standards. When we say minimum standards, we want to see health facilities where these minimum standards are really in place, not just minimum standards in guidelines alone, but minimum standards at every point where an adolescent meets with a healthcare provider. Other ways and other things that we need to take care of as we look into the future, what are the things that we need to focus on? Thankfully, we have a relatively new guideline by WHO on school health services. School health services in Nigeria have been around like forever. We have a school health policy. However, many times what we see is that school health services are comprehensive on paper. They are not as comprehensive in the schools. And So we need to start thinking of innovative ways to ensure that school health services are really what they ought to be, because this is one good avenue for catching adolescents young. This is one good avenue for being able to monitor adolescents, to introduce them to adolescent-friendly services. And once this is done, we can be sure that throughout their trajectory, throughout their life, they see the health facility as a friendly place. They see it as a place where they can always go to and their needs will be met. Now to training. To address adolescent health problems as it ought to be addressed, it's important for us to focus on training. However, training is not what it's supposed to be. And this is not just a problem in Nigeria, it's a problem globally. At many of the International Association of Adolescent Health meetings that I attend, we talk about how we can standardize training globally. How can we ensure that people are properly trained to be able to meet the needs of adolescents? And this can be done at various levels, at undergraduate level, at postgraduate level, and even at the level of having certificate courses where people can improve their knowledge periodically, because we know that attending one course, being taught at undergraduate level, being taught at postgraduate level, one-off trainings are not enough. It's important to have update trainings. And so we need to ensure that in our medical students' curriculum, there is enough space to deal with adolescent health, so that our medical students are equipped to be able to attend to adolescents. Nursing students as well, even the teacher training curriculum too. At postgraduate level, it's also important to have specialist training in adolescent medicine and health, and also for us to have master's and doctoral training for adolescent health professionals and certificate courses too. Research, we can never underplay or undermine the effect of research. If you had noticed, a lot of the data I presented were 2019 data, which came from UNICEF website. That speaks to us and tells us that we don't have enough current data with respect to adolescent health in Nigeria. In Nigeria, the National Adolescent Technical Health Working Group is trying to bridge this gap, because we have a data subunit that is trying to ensure, working hand in hand with governments, to ensure that at every point when data is being collected, data for 10 to 19-year-olds are collected. We don't want our adolescents subsumed under women of reproductive age. That sidelines the boys, and that means that at the end of the day, it is only issues about reproductive health that we are getting information about. The importance of communities of practice, we cannot undermine. It's important for people who identify as adolescent health professionals to have groups, to have associations where they can meet to exchange ideas, to learn about what is current and to plan for the future. And so at this point, I introduced to us the Society for Adolescent and Young People's Health in Nigeria. It is the umbrella association for adolescent health practitioners and young people as well in Nigeria. And we are planning to have our conference in Lagos between the 16th and the 19th of August. And on behalf of our chair and our co-chair, I'm extending a warm invitation to everyone on this webinar. In conclusion, we know that adolescents comprise a significant proportion of our population in Nigeria and globally. We know that sub-Saharan Africa is on the path to becoming the home to the largest number of adolescents. We know that it's important for us to give priority to the health of adolescents, and this will enable us to enjoy the demographic dividends that would accrue from having a critical mass of healthy, well-developed young people. If we don't, the keg of gunpowder we are sitting on is going to explode much faster than we can imagine, and we are all going to get caught unawares, and we do not want that to happen. So please, beyond this webinar, I would like all of us to go home with the message that adolescents are key, and we all must do whatever it is that we need to do to ensure that we have a critical mass of healthy, well-developed young people. Thank you very much. Sorry, Dr. Adiba, you need to unmute your microphone.
I thought I had done so. Thank you so much, Prof. Ma. Thank you for the beautiful, succinct presentation. I know if we gave you 1 hour, you would have gone ahead and said so many more things. Thank you for sharing. Prof. Sir, Chairman, Sir, Professor Adewale, sir, with your permission, I'd just like to go to the next person, and then we can take questions and comments at the end of everybody's presentation. Is that okay, sir, Prof. Sir?
Please go on.
All right.
the next one to the next one to the next one. You are the moderator.
All right, sir. Thank you, sir. Okay, so we have our next presentation now, and that's from Professor Bola Dale Makpayi. I know she won't know me, but I remember somebody was even mentioning out to me some days ago, some weeks back, and said, she gave one presentation on research methods, and it was fantastic. It was, I'm sure she doesn't know the person, but adolescent health in Nigeria, making mental health count in programs and research. That's what Prof wants to talk to us about. Professor Bola Dale Makpayi is a behavioral scientist and mental health expert with a bachelor's degree in medicine, a master's degree, and a PhD in clinical psychology. And she's a fellow of the West African College of Physicians in psychiatry. She has also specialized in, and done training in rational emotive behavior therapy. She has participated in several agenda setting initiatives concerning gender, sexual minorities, sexual violence, adolescents, and young people, as well as the development and reviews of multiple national and international technical reports. Ladies and gentlemen, please let's welcome Professor Makpayi as she gives her presentation. Over to you, Ma.
Thank you very much, Dr. Adebayo. I do remember you, and thank you for the kind introduction. Please, if I could be given the privilege of sharing my screen, that would be great. Before I continue, please allow me to say a warm welcome to everyone. Thank you so much for having me. To the chairman of the occasion, distinguished medical elders in the house, thank you so much. It's an honor and a privilege to be here today talking on this topic. Let's just make sure that I can share my, I'm still disabled from sharing my screen. Okay, great.
Please share your screen.
Thank you very much. And I would also like to give a shout out to all adolescents on the platform, and indeed all adolescents in Nigeria, because our adolescents are doing great work. You know, the field of adolescent health has always been interesting, but it got even more exciting when the adolescents themselves came on board. And this is a shout out to adolescents everywhere, breaking all the ceilings regardless of the materials they are made of. I would like to thank the organizers and Nigerian Academy of Medicine for this kind invitation for this program. Talking about adolescent health in Nigeria, making mental health count in programs and research. And what I like to call making adolescent mental health count in Nigeria. Very quickly, we will ask ourselves the questions: where are we now? And where are we going when it comes to adolescent mental health in Nigeria? But we'll also ask the pertinent questions of how do we get where we're going, and why should we move from where we are to where we are going in the first place? So where are we now? We know that the current population of Nigeria is over 200 million, and we're growing. We're plenty in Nigeria, basically. But we also know that Nigeria has a very young population with a median age of 18 years and almost half of the population being between the ages of 0 and 14. So what we're saying is 1 out of every 4 Nigerians are adolescents. And we must take cognizance of that. In terms of our health indices, I know Professor Olumide has said quite a number of things about it, but it's not all doom and gloom though. Because we are rising from the ashes, kind of. We are doing relatively better than we did last year, for example, on quite a number of our indices. So that's a win in my books. And I mean, cup half full, half empty kind of situation. So half full, maybe. But we know that our maternal mortality ratio is still high. We're aiming for becoming below 500 in the next few years, so we really need to work hard. Our mortality rate for infants and children under 5 are still relatively high, and even more importantly, there is this there is a significant disparity in health status that exists across states, geopolitical zones, the rural-urban divide, education, and social status. So that inequity must be dealt with. And then, of course, we still have a problem with communicable diseases, non-communicable diseases, and poverty is still pervasive. What about the adolescent mental health scene in Nigeria? Requires peculiar insights. Globally, we have 1 in 5. In Nigeria, it's 1 in 7 adolescents that have a mental illness. And up to half of all mental health conditions actually start before the age of 8 or 14. So it becomes important to look at this. And then most of those disorders remain undiagnosed and untreated. We also know, like Professor Olumide has said, that adolescents are going through this transitory period with a lot of changing transitions across multiple domains. So we have the physical, social, emotional, cognitive, the intellectual. And so if those problems are so multifaceted, then our approach to them must also be multifaceted. And from the stats that we have looked at concerning the demography of Nigeria, providing comprehensive mental health services for adolescents alone meets the indirect and direct needs of over 20% of Nigerians. And so that brings us to why. Why should we move from where we're at in terms of our indices for mental health? We know that mental health conditions are one of the leading causes of disabilities in young people. And I know that Professor Olumide touched on this, the issue of mortality versus morbidity. We know that though we consider young people to be healthy, and that includes mentally healthy, but the truth of the matter is that when they are in the phase where they are forming connections that will help through their life course, and if there are any discrepancies, if there are any breaks, if there are any problems along this continuum at this stage, then it will affect the rest of their lives. And so it's important for us to begin to think of how we can intervene at this point. We also know that poor mental health in adolescents portends a range of high-risk behaviors that have serious implications throughout the life course. And we know that there are complex social, cultural, and economic environments with growing challenges. If we look at Nigeria today, we find that there are complex social, cultural, and economic environments for adolescents to wade through. We've talked about inequities, especially those linked to poverty and gender, and this shape all aspects of adolescent health and well-being. Of course, we must remember that, and I think Professor Olumide mentioned this again, that there are discrepancies in terms of how adolescent subgroups are affected. So young disadvantaged people from minority and migrant communities are also affected more. And of course, we must not forget gender. It has a huge role to play because sociocultural factors like lower education, poverty, exposure to domestic violence, and low decision-making power tend to increase the risk for girls. Adolescents account for a large population of individuals in Nigeria. We know this. And we know that the statistics for mental health disorders are high in Nigeria. We have issues around depression. We have upwards of the 20%. We have issues around anxiety. Anxiety is actually the most common mental disorder for adolescents in Nigeria. We have issues around psychoactive substances. And I'm glad that Professor Olumide made my job so easy by talking about even the novel psychoactive substances that we have in use amongst young people in Nigeria. And we also have issues around suicidal attempts and ideations. Very high figures when we look at them for adolescents in Nigeria. Now, where are the problem areas for adolescents in Nigeria? We have issues around relationships, whether it's relationship with family or peers. We have issues in school, whether it's academic activity, but more likely, like Professor Olumide mentioned, opportunities around academic activity. So it's not just that, where can I fit in, regardless of how well or how poorly I do in school, and that we must create those opportunities. Issues in their immediate community, in their wider community, issues around inequality, migration, and gender norms. But it's not all doom and gloom though. there are opportunities for health promotion and disease prevention in adolescents. And that is part of the reason why we're here today and why this topic is so important. Adolescent period is also the optimal time frame for intervention because it is the time when majority of the mental health issues crop up. It is also the time when adolescents are participating in risky behaviors, and this time can be used for interventions that will make the most impact for adolescents. And like we like to say in mental health, there is no health without mental health. And that brings us to where we are going. Where do we want to be? The goal is to have adolescents in Nigeria who have improved well-being, reduction in risky behaviors, improved school retention. And I was so excited when the minister was talking about the WCA, because I think that that's a great initiative that will ramp up investments, that will ramp up advocacy, and that will ramp up interest in adolescent health, including, of course, adolescent mental health. And opportunities for productive engagement. So again, I'm coming back to not just the formal education, but the informal sector. How do we get our young people involved? How do we give them opportunities to blossom, to thrive, to do well? Healthier sexual and reproductive behavior, fostering positive relationships, and the ability to build their leadership strength. And how do we do that? It is through mental health promotion. Ladies and gentlemen, you have heard the phrase, prevention is better than cure. I am happy to tell you today that there is something that is better than prevention, and that is promotion. And so we're talking about mental health promotion. And mental health promotion basically aims to develop psychological well-being skills and resilience for young individuals. Also to build supportive living environments around them. Because if you look at that ecological framework that Professor Lumide shared, you will find that we start as individuals, but then we blossom out into the larger community. And these are the areas where we need to intervene and support young people too. And of course, to improve communities, families, and people's capacity to cope with adversity. And so where is our utopia? Ladies and gentlemen, our utopia is this. Think about the average Nigerian adolescent. So we want an adolescent that will self-regulate, get plenty of rest, exercise and eat good food, be able to communicate and socialize with friends and families, be able to express feelings and emotions. We want them to be good listeners and effective communicators, to have friends and peers who are reliable, respectful, and trustworthy, to have parental affection, to live in safe and secure home environments with family unity and harmony, positive parent or guardian relationship. We want them to go to schools where they are supportive teachers, where they are physically and psychologically safe, where there is no sexual harassment, for example, where there is no dating violence, where there is no violence, where there are no psychoactive substance use, And then we want counseling services in our secondary schools, in our universities, and then to encourage that they are encouraged to have non-academic learning, that they're able to get support from their religious community, that they are able to self-regulate and limit time on social media. Did you hear that right? Limit time on social media. And then, of course, they're able to participate in community networks. I know that as I'm saying all this out, you are saying to yourself, tell us how to get there already, because we need to get our adolescents to this place. So how do we get to where we're going? How do we get to the place where our adolescents are mentally healthy? How do we get to the state where we promote mental health instead of just prevent mental illnesses? Both are important. They go hand in hand. Let's talk about global strategies. There are quite a number of resources. I only fit in 3 here, but Professor Lumide shared quite a number already. Globally, in Nigeria, we have so many resources already that we can make use of. So we don't have to start from ground zero. We already have things that we have built. And so we can hit the ground running in terms of actually looking at the initiatives that work. Let me start with the Helping Adolescents Thrive initiative, a joint initiative by WHO and UNICEF, built to strengthen policies and programs for mental health of adolescents. And then there's a global strategy for women's, children's, and adolescent health, which incorporated a survive, thrive, and transform agenda into its approach. And of course, we have the child and adolescent mental and behavioral disorders as part of the MH Gap Intervention Guide, which provides evidence-based clinical protocols for the assessment and management of a wide range of mental health conditions in non-specialized care settings. And this is where the evidence lies, actually, that people are trained within the community that can actually conduct or deliver this very low-paced mental health psychosocial support, not just to adolescents, to other members of the community. And this will help us, especially in a place like Nigeria with our resource constraints. There are a lot of evidence-based strategies that WHO has helpfully tried out and piloted in several countries around the world, both the high income countries and less likely the low, middle income countries. And quite a number of them are either universal or targeted or indicated. And these strategies have also been used in different settings. So we have schools, we have a facility-based, we have family-based, we have community interventions and the rest of them. And this is where the evidence lies. Number one, that universally delivered psychosocial interventions, including emotional regulation, problem solving, interpersonal skills, mindfulness, assertiveness, and stress management should be provided for all adolescents. I know at this point people are going, the curriculum is already so packed up. So how do we include more? People in the educational sector, I'm sure we've had meetings where they have said, you have already killed this curriculum. How are we going to do it? But I keep on saying that we don't have to reinvent the wheel, because there are already initiatives or strategies that are already working for us. Take, for example, the family life and HIV education strategy that was rolled out quite a number of years ago. Of course, don't ask me about the implementation and the evaluation. That's a story for another day. But we know that it works. We have used it. We can see that it actually makes a difference. And there are implements of mental health, and part of what we're talking about, emotional regulation, problem solving, pro-social skills that are already in the family life HIV education strategy. So we can build this up, and it doesn't mean that we're going to add on hours of training. No, very simple, easy to follow steps for educators. We can also go through the school clubs, the after school clubs, and we have quite a number of them. So there are quite a number of opportunities for us to roll these things out if we actually want to. And there is a lot of evidence that speaks to mental health promotion that is universal through this kind of strategy. There are also targeted psychosocial interventions for adolescents affected by humanitarian emergencies. And I know that quite a number of my colleagues up north in the Bay regions of the country are really working hard to get these interventions to some of the people that have been affected by humanitarian emergencies, even within Nigeria. So kudos to my colleagues out there. And then there are the indicated psychosocial interventions that should be provided for adolescents with emotional symptoms and disruptive and oppositional behaviors. We also have evidence from a review by Das et al. That was in 2016. And they looked at several interventions that had been tried and had a review of them and looked at what worked and what did not work. And what they found was that quite a number of interventions, again, whether they are school-based, facility-based, community-based, individual or family-based, and the rest of it, have been offered, and they have used quite a number of innovative strategies. So, for example, community-based creative activities had some positive effect on behavioral changes, self-confidence, and the rest of it. School-based interventions suggest that target group-based interventions and CBT were effective in reducing depressive symptoms and anxiety. Now, they also had evidence from digital platforms which support internet-based prevention and treatment programs for anxiety and depression for adolescents. And then individual and family-based intervention showed that exercise was quite effective in improving self-esteem and reducing depression score.
Prof. Ma,
on anxiety.
if your time is, we need to round up this
I'll
session.
finish now. No
Thank
problem. Thank you. And then there was a scoping review by Mabrook that looked at CBT, especially being most frequently used mental health promotion intervention, and they had been used in diverse settings. What about Nigeria? And I'll end here. In Nigeria, we've had quite a number of interventions rolled out, and quite a number of my colleagues are working on this. You can see some of the interventions here. But I wanted to touch quickly on a proposed one-stop shop approach for the delivery of integrated oral, mental, sexual, and reproductive health care to adolescents in Nigeria. I know that we've worked in silos for a long time, but it's time to come together and integrate all these services. We know that there is a common thread running through when it comes to adolescent health. We can harness this in terms of making impactful interventions for adolescents in Nigeria. Allow me to stop here, ladies and gentlemen. Thank you so much for giving me your time and attention, and it's a pleasure to be here with you. Thank you. Over to you, moderator.
Thank you so much, Prof. Thank you. We are grateful. You've shared so much. I know if we are sorry, it's just 15 minutes for every speaker. We just wanted to, like Prof. The chairman said, was to be a feast. So we just want to eat as much as possible, and we'll take questions as we go. So some important things are coming up as we go. I think as we go to the end, we'll pick them up. But that's the importance of data, knowing what is happening in our environment, so that we don't have the curious data. And that came up when we were doing the National Youth Index of the Sparkle Initiative of the University of Medical Sciences, where the WHO data suggests that the leading cause of death for 15 to 19-year-olds is diarrhea. We found that very, very curious. And I think our homegrown data is going to be important to make sure that we are saying we are putting things up. And so we have our third speaker here, and I'm happy that our third, because like Professor Patrick said many years ago, that young people, adolescents, are not sex working on two legs. Because often when we talk about adolescent health, what people usually want to talk about is sexual and reproductive health. I'm happy that it is the third and not the first year. But we have somebody eminently qualified to come and talk to us about this very, very important component of adolescent health. That's adolescent sexual and reproductive health in Nigeria, policy issues. And that is in person of Dr. Ejike Oji. Dr. Ejike is the former Senior Special Assistant on Health and Hospital Management to the Honorable Minister of the FCT. Currently, he serves as the Family Planning Focal Point for Nigeria for FP 2030, as well as the Chairman of the Technical/Strategic Management Committee of the Association for the Advancement of Family Planning. He is the Chairman Strategic Management Team for the Maternal, Newborn, Child, and Adolescent Accountability Mechanism. Dr. Oji played a crucial role in convening Nigeria's flagship biannual family planning conference. Prior to this, he served as a country director of IPAS Nigeria, where he helped shape policies on women's sexual and reproductive health and rights in Nigeria. Specifically, he was instrumental in the shaping of adolescent sexual and reproductive health policy, the FP Blueprint 2020 to 24, and the FP 2030 Recommitment Policy. Ladies and gentlemen, please let's welcome Dr. Ejike Oji. Over to you, sir.
Sure. Thank you, moderator. And then I want to bring warm greetings to all of you from Abuja. If I might seek permission to be granted access so that I can upload my slides. Okay.
You are a co-host.
You
can share.
There? Okay. Okay. You can see my slides now.
Yes.
Can you see?
We can see it.
Okay, thank you. Now, thank you very much for asking me to speak on this webinar. I've also listened to other speakers. I've learned a lot from all of them. Thank you, colleagues. I'm going to be speaking on the sexual and reproductive health in Nigeria, adolescent sexual and reproductive health in Nigeria, the policy issues. First of all, as an introduction, there's a lot of things that have already been said by other speakers, but I want to also flag the importance of healthcare access. And then the major policies that can help young people are policies that would reduce the barrier to access, which all these policies have tried to address. But in my concluding statements, I would also share my recent experience we just came back from Uganda from the FP 2030 Anglophone 18 countries focal points meeting regarding the issues of adolescence and how we, the Nigerian team, also played a big role in confirming where we should be going. And let me list out the existing policies that we have. You can see Nigeria has the National Adolescent Health Policy. We also have the National Health Policy. We have the National Policy on HIV and AIDS, and a few people have touched on this during their own presentation. And then you can also see the Strategic Framework on Reproductive Health and Development. We also have National Policy on Nutrition. I was very delighted to hear somebody going to speak or have spoken on nutrition. The importance of that in the adolescent health, as we're talking about. I think the last speaker did mention we should not be talking about prevention, we should be talking about promotion. And the National Policy on Child Welfare and Development, the National Policy on Education, and the National Guidelines on Adolescent-Friendly Health Services. These are policies all this time have been put in place. You can see that Nigeria is not a country that lacks policies. And then let's talk a little bit about each of these policies. You could see that the National Adolescent Health Policy was launched in 2007. And it focused on promoting the health and development of adolescents aged 10 to 19 years by providing equitable access to relevant information and health services. Equitable is the underlying word there. The second one is the National Reproductive Health Strategic Plan, launched in 2017. And this aims to address the gaps identified during the implementation of the first one, and then which included low contraceptive usage among young people and inadequate communication about sexual issues within families, school, and mosques. The third one is the National Family Planning Blueprint, which started implementation in late 2014. This policy provided specific strategies for improving family planning programming all over Nigeria, including increased contraceptive use amongst adolescents. The fifth one is a national policy on HIV/AIDS. This policy focused on vulnerable populations, including young people living with HIV/AIDS, which is widespread in Nigeria and can have significant impact in adolescent reproductive health. I think one of the speakers did mention the fact that some of the diseases that people contract in their adolescent days harm them in their old age. And I think this is one clear example of that. The sixth one is the Comprehensive Sexuality Education Curriculum Framework, which was launched in 2014. This framework provides a basis for developing comprehensive programs of sexuality education for schools across the country to teach adolescents about sexual and reproductive health issues, being able to make informed decisions that will guide them through their teenage years into adulthood. I'm going to come back to this and speak a little bit more what's this particular CSE, the controversy, and what was done about that. I'm sure all of you do know that already. The seventh one is the National Strategic Health Development Plan. The policy thrust was investing in young people, to improve family planning, safe sex practices, and HIV/AIDS awareness. While these policies play a critical role in addressing the policy issues that surround adolescent sexual and reproductive health, their implementation remains a challenge due to cultural beliefs, stigma, funding gaps, among other areas. Now, in terms of these, I remember I did mention about the CSE. Stakeholders at all levels, from community leaders to policymakers, so need to collaborate by embracing evidence-based integrated approach to promote sexual reproductive health and rights through investment, not just in the education system, but in research. So I'm glad that we're going to talk about research here, and also into the peculiar needs of the adolescents by making available appropriate materials and safe spaces, as well as enforcing and monitoring effective implementation. When we say safe spaces, in my final list, I'm going to talk about integration, which will be a way to provide those safe spaces. But speaking more directly to the comprehensive sexuality education, there was an uproar, especially in the northern part of the country, immediately this was introduced. And some of our friends and colleagues up here pushed back and said that this, in other words, if you translate it in Hausa, so to speak, it shows teaching your children how to have sex. So, and that was why it was renamed to family life education, to make sure that is acceptable culturally up north, even though the whole, most of the things that were there were still there. And the primary goal of this was to help people develop knowledge about human growth and development, sexual health education, as well as larger understanding about overall family dynamics. And it covers topics including, but not limited to, effective communication within the family unit. A lot of people are so morbidly afraid of talking to their children about sex. Meanwhile, if you don't talk to them about sex, they'll get that information from their peers, who will give them all the wrong information. So it was important to underline this and make sure that adequate information is given based on the age of the child. And then also it was to be utilized across different educational environments, such as schools, healthcare facilities, and community centers, which offer sessions on skill development programs, and also involved interventions that aim at helping people develop personal and interpersonal skills to better handle relationships both in the family and within their communities. Now, the curriculum was designed to ensure that learners understand concepts related to understanding themselves, handling stress and emotional regulation, body care, life expectancy, and healthy living habits like exercise routine. I think it's been mentioned by one of our speakers here. Women's sexuality, development during adolescence, including emotional behavioral changes, maintenance of healthy relationship, anger management, decision making, and all that. So you can see that some of these policies, I don't see why we should even lack anything in terms of what we should need to do things. And I think moving on, there are recent policies that, after the other ones I've listed, is the National Adolescent Health Policy in 2020 and the revised National Policy on HIV 2021, the National Framework on Reproductive Health and Development 2019 to 2023, and the National Mental Health Policy. I'm glad that one of our colleagues have also spoken about mental health. In 2016, I co-developed a program with the the hospital in Enugu, the neuropsychiatric hospital, where they did an intervention to take awareness to the 5 states in the Southeast. It was a federal government supported initiative at that time. We were appalled when we did a situational analysis. We found out that 45% of patients who showed up at the hospital were adolescents, and most importantly, they were young women. So these are some of the things that we should really look at. And then, of course, the National Policy on Nutrition, which, anybody can agree, this is important in terms of promotion. If somebody eats well, promoting health, so it will prevent and then also make sure we do not get into other diseases. Then the last one on this list is National Guidelines on Adolescent-Friendly Health Services. Now, for me, there are other overarching policies. In 2019, I led 3 other consultants to consult with the 42nd regular executive course of NIPS. When the federal government, the president had directed them to focus on population growth challenges and human capital development. And then out of the 14 recommendations that were put in that policy, of course, the major one everybody was shouting about and was very happy about was the launch of the National Population Policy. But within that, we were able to craft in the future of job. And all of us do know that the future of job is actually targeted to our young ones now. In 20 years' time, when they are adults, if they don't have the skills and ability given to them now, they will not be able to compete in the evolving international order of innovation. So, and that's why we made sure that that was inserted. Now, all of us also do know that STEM training is also very important, because from childhood to adolescence, it will help also make the adolescent equipped to be fully engaged in innovation, that they won't have time to go practicing very risky behaviors. Now, like I said, I did mention about the meeting that we just came back from. It is obvious, which is something some of us have been shouting out in Nigeria. There is no way we'll be able to succeed, no matter how policies that are in place, if we do not make a major integration of adolescent health services with the existing service centers. So it's important we know the importance of this. And then the reasons for that is that, first of all, we have very limited resources to build standalone services. And then, of course, all of us do know the stigma that is attached to any standalone adolescent reproductive health center. And then because of that stigma, a lot of young people will not want to access that service. And then, of course, we do know the very major problem we have about provider biases. And when a child goes to the restaurant, you say your father sent you and your mother sent you to school and you're busy playing with boys. And then, of course, it's important for us to know that if all these policies, of course, there should be a proper training of health services, but it's important also we'll make sure that that training is done within an integrated services framework. Now, what I wanted also to allude to the fact about some of the experiences that I've learned. About 4 years ago, when we were in Malawi for this same meeting, I was so keen on knowing what the Malawians were doing in terms of improving their contraception rate, which had gone up to 45 to 50% as at that time, and we were struggling with 12. And one of the key things they told me was that they introduced school-based reproductive health services. And I said to them, what do you really mean? And they said that they had to send teams to the hospital, to the schools. And I said, didn't you have any pushback? And they did mention they had one important pushback, where one of the women, the child was 16 and received services. And then the woman complained to the Minister of Health, who now called a meeting. And at the end of the day, it was resolved because the girl didn't tell them that she was already sexually active, but told the people to administer the contraceptive method on her. So, ladies and gentlemen, I want to stop here, and I'm sure we're going to have more conversations around this. But my parting words is all the policies that we're doing, if we don't focus on integrating services within existing facilities, it will be difficult for us to meet our needs. Thank you for listening to me. Over
Thank
to you
so much, sir. Thank you for the beautiful, succinct, practical presentation. If you are just joining us, thank you so much for joining us. If you have not greeted us, that means you have not yet joined us. So please, I would like everybody at this time to just go to the chat box and say good afternoon. The last time we did it, just about 10 people said hi to us. So can you please just introduce yourself, tell us where who you are, where you're joining us from, say good evening, good morning, good afternoon, good night, whatever it is you want to say to us. Please can you just go to the chat box now and let's say some hi. We've not had some feedback, we've not had feedback. Yes, fantastic. Thank you. Beautiful presentations. I agree. Great presentations. I agree. Can we have some interactivity? Yes. Oh, okay. Good to see you again. And so we greet our teachers. It's a fantastic thing to have your teachers in the audience. Of course, Professor Gumade, Professor Batusi, who are calling out shortly. They all taught us in med school. Of course, Professor Dewale is examining us and all. So can we just, good afternoon, just say hi, let's have more people. If you are still here, and please let's not forget at the end, we're going to have our attendance photo shoot, right? So we just take a screen grab of everybody. So let's just please stay to the very end so that we can capture everybody that's come for this very, very first webinar of NAMED, very first webinar of NAMED. So let's just go ahead and with the introductions. And then without further ado, I will go to the last of certainly not the least of the presentations that we have today. And we have the honor of having one of the foremost adolescent health practitioners and experts and consultants in the world. And of course, one of the leading lights in Nigeria. And it's no other person than Professor Adeshegun Fatusi. And he'll be taking us on the national policy framework for improving adolescent health in Nigeria and the implementation challenges. I'm not sure Professor Fatusi needs introduction to many of us here, but I'll just go ahead and read this really brief, abridged profile. Professor Adeshegun Fatusi is an adolescent health specialist and the Vice Chancellor of the University of Medical Sciences, Ondo. He has served as a consultant for developing adolescent health policies, programs, and training in Nigeria and other countries. He is the chair of Nigeria's National Technical Working Group on Adolescent Health and Development and the foundation president of the Society for Adolescent and Young People's Health in Nigeria, SAFIN. He is a member of the Lancet Commission on Adolescent Health and the past vice president, Sub-Saharan Africa for the International Association for Adolescent Health, and is also my teacher in med school. So ladies and gentlemen, it's an honor and a privilege to welcome Professor Adeshegun Fatusi. Over to you, sir.
Very much, Benga. It's a great honor to be here, and I want to start by saluting all our medical elders, Professor Dugwemi, Chairman of the Beauty of NAMED, all other leading lights in NAMED and Nigerian health sector. It's a privilege to be here tonight to be speaking along colleagues who I've worked with for very many years. I'm going to be focusing squarely on my topic, and I think one of the great things about being the last speaker is that many of the things you want to say will have been said, and so there will be room for not for saying as much. So I'm going to be talking about national policy framework for improving adolescent health in Nigeria and implementing challenges, just like the moderator Benga Adebayo, my very good friend, had already mentioned. So 3 things that this presentation will cover essentially. 1, provide some policy context. 2, dwell with in the area of policy provisions, and then finally dovetail into the issue around implementation. But let me just quickly add a few words to what my colleagues had said, particularly about adolescent health. When we talk about adolescent health, we are actually dealing with a paradox. This is the healthiest period of life. Young people are the fastest, the strongest, the most clever of all groups. I'm sure for many people who are old, they know that if you need somebody to teach you how to use your phone better, you need to talk to one of your grandchildren or someone like that. They are the sexiest, they are just great people. But yet, fact is that mortality and morbidity rise to adolescents. In fact, as of current data says that over 1,000 adolescents die every day. And in Nigeria, the latest data is about 60,000 adolescents are dying in the year. But the saddest thing is that they die from largely preventable causes. So in other words, you could have, if you've done the right thing, you will have saved the life of these young people from dying needlessly. And when we think about it, what historical data has shown us is that our neglect of adolescent health agenda has caused the world so much. As we take a look at this graph that was produced by Vanna et al., and the red color has to do with children and as against adolescents. And you find that over time, death among children had gone down very significantly with all the interventions we've had. This is about male. The same pattern is repeated in females. But when you take a look at the adolescent, and that's the purple color, you find that more or less it has stagnated over time, over a 50-year period, it has stagnated. But there are even worse information now. The latest publication, a semantic analysis looking at data from 1990 to 2019, has some very startling data, some startling facts. That in 1990, the probability of dying for a young person between age 15 and 24 was about half the probability of dying between age 1 to 5. In other words, childhood death rate, the probability is higher than when you compare somebody who has survived childhood and had managed to get to adolescent. But in 2019, the data shows that right now, the risk of dying as an adolescent is higher than the risk of childhood death. So young people have, after the very early, the first year of life, young people now have the higher rate of death, higher probability of death, compared to those between age 1 and 5. And that's a sad reality. And I'd like to quote this word from the paper published by Masquela et al. And the UN Intelligence Group, that it is urgent to accelerate progress in reducing youth mortality. Efforts are particularly needed in sub-Saharan Africa, where the burden of mortality is increasingly concentrated. And it's on this note I want to congratulate NAMED for making its first webinar to focus on this issue, and to thank the organizers for putting this together. So as we think about what I've just said, what may strike any individual is that, oh, if we do well with adolescent health, then adolescents will die less, their lives will improve. That is true, but that is not the complete fact, because investment in adolescent health yield not only privileges and not only benefits for adolescents, but yield privileges across 3 population divides. 1, for the adolescent of today. 2, for the future adult, because we do know that 2/3 of preventable deaths in adulthood are due to causes, behavior that are started as adolescents. And Professor Olumide had already alluded to that. And we do know that because these are the next generation of parents, whatever we do to them today also determine the future of the next generation of children that we have, including the rate of morbidity and mortality among in the first year of life and in childhood. And so this is not just about doing something for adolescents so that we can improve the life of adolescents. It goes far beyond that. And like one of my colleagues had earlier said, we must also think about the issue of things like demographic dividend. So this is something that brings much more benefit to the entire society if you could simply invest in the life of adolescents. So let me then move on from here to talk about the Nigerian dimension and the policy context. Sometimes people ask me, why do a policy? I've been privileged to lead several policy development in the country, including the last adolescent health policy and the current adolescent health policy. And one of the things I often tell people is that policy provides the platform for framing national agenda and for connecting stakeholders around a common point. And it provides the template and the platform for integrating works so that there can be awesome commitment, and there can be more robust coordination. But policies are never sufficient themselves. And one of the things that we often miss in Nigeria is to understand the fact that the policy need to connect with a number of other strategic instruments to become a reality. When you start with the policy, you must think about, okay, how does this become a strategic plan? Because the policy tells you the intention, but it doesn't tell you how you're going to do it. All those other details are detailed in other things like the strategic plan, the implementation plan, and all that. And so it is when we go through this cycle of the strategic plan, which covers 5 to 10 years, go to the implementation plan that covers 1 to 2 years, that are more detailed, and then manage the implementation. I end up being able to evaluate, and in evaluating, use that result to drive the next policy. That is when we are being meaningful and we are being intentional in activities. Unfortunately, Dr. G lists a lot of Nigerian policy. The fact is that many of them don't even have implementation plans. And so part of the disconnect that we have in the policy arena is the fact that we just think about policy as one paper to develop, but we are not following through an entire network of what make policy implementation a reality. I'd like to just go back to emphasize the fact that the reason why Nigeria thought about adolescent policy is because we realize that we are not giving enough attention. And I'm quoting this from our very first policy that was prepared in 1995. It says, most national health programs provide for children and the aged, recognizing their susceptibility to certain diseases due to biological factors. Because adolescents are less vulnerable to these diseases of childhood and of the elderly, little emphasis had been placed in this count on the health needs of this age group. And that is why the result we are having today is that probability of death in adolescent period has now overcome that of the childhood period because of this neglect that we have been having. So Nigeria has gone through this circle of 3 policies when it comes to adolescent health. And I can say to you that many of the policies that Dr. J has spoken about all have some relationship to adolescent health in some ways. But the National Adolescent Health Policy becomes the platform for integrating the entirety of national action and consciousness about what we need to do about young people. And so we've gone from our first policy in 1995 to our next policy in 2007 and to our latest policy launched in 2021. This is the launch of the 2021 policy, which interestingly happened at the second national conference on adolescent and youth health that was organized by Society for Adolescent, Young and People's Health in Nigeria, which is incidentally, I still serve as the current president. And that policy is what I'm going to be focusing on more in the next few minutes. So what does this policy mean? But I would like to go beyond what it says to also help you understand why it says what it says, being an insider in the policy development work. So the vision of this policy is that we want a healthy life and optimal development for all adolescents and young people in Nigeria, and to ensure that they successfully transit towards a healthy, active, productive, successful, and fulfilled adulthood. Our policy, by the way, even though we call it National Adolescent Policy or Adolescent and Young People's Policy, covers the range of 10 to 24, even though we recognize that adolescents are 10 to 19, and 10 to 24 talk about young people as a whole. So what are the things that determine the way we frame this policy? Because sometimes people ask the question, why did you put this way? Why are you doing this? And it's important to understand what informed those activities. When you go back to 1995, up to 2007, what you find is that our policy had focused a lot on issues of sexual and reproductive health and further issues, and left other issues. And the reality was that we didn't have the data to drive the policy. But we are privileged in developing the last policy that we have more robust data that have come from the global body of disease study. And it shows us clearly that even though sexual and reproductive health is what we shout about a lot, they don't constitute the majority of the problem among young people. When you take a look at this, you find that physical disorders play a bigger role. You find that things like unintentional injury plays bigger role. And if they are playing bigger role and our policy are not speaking to them, then our policy is not on target to achieve what it really wants to achieve, improving the life of young people. So That's one of the issues we're looking at. The second issue that helped us in the framework of this policy was to look at the entire coverage of adolescent health services and young people access as well as the barriers. And we're looking at the issue of availability, accessibility, acceptability, the content and the usage, the content and usage and effectiveness. In fact, we did a study just before the policy was framed to understand this issue so that the policy can speak specifically to this element. The third dimension that is important to understand is that adolescent health is not about adolescent health sector, because the reality is adolescent health is a multi-sectoral agenda. And whereas you take a look at things like information and life skill, that is not in the domain of the health sector per se. It is in the domain of education sector. The kind of thing we were talking about earlier on today, and which the former minister spoke about, the integration between health and education is important if you must improve adolescent health. But health sector has its own area of dominance, service and counseling. So if you talk about adolescent health policy, it cannot just be something that is about health sector if you truly want to achieve results. That is the point I want to make with this. If you take a look at things like safe and supportive environment, you need to think about Ministry of Youth and the legal sector to make things happen. So the fourth thing I like to emphasize is that in framing this also, it goes back to the framework that Professor Olumide was talking about. For us in adolescent health domain, we don't talk about just risk factors, but it's also important to talk about protective factors because they are more powerful in talking about young people. And we must think about the various levels, like Professor Makpai spoke about. What's happening at the family, at the school, at the community, at the policy? Because what we observe as behavior among young people is simply the tip of the iceberg, and we need to dig down into all these dimensions to understand what we need to do. And finally, the final consideration we're looking at was at the global best practices in policy framing, particularly the Global Adolescent Action for Health of Adolescents, which incidentally, a study in Nigeria was part of what helped to frame this at the global level. And so what did this policy, or what is this policy focusing on? 8 things constitute the core target for this policy. But interestingly, as you see, 4 of them were never part of the whole policy. Again, this was due to the fact that we examined the data available with new eyes and rigorously look at them and say, how does this connect with where we want to go? So the first element we are looking at is sexual and reproductive health and rights. The second was mental health, substance and addiction. The third was violence and injury. The fourth was nutrition and physical activity. The fifth has to do with non-communicable diseases. The sixth was about disabilities. The seventh was communicable diseases, particularly among early adolescents, because early adolescents still have issues about respiratory challenges and diarrhea and all that. And finally, for the first time in the history of Nigeria, we brought oral health to be part of the adolescent health policy focus, again, because we understand more and more the need to integrate oral health with many other things that we are doing in the country. And there are 10 strategies that are critical to achieve our objectives. And each of them, we need to focus on them. It's not one or the other, but about integrating these approaches. That's how we're going to get to where we are going. One is about advocacy and resource mobilization. Advocacy is needed to win policymakers to understand the importance of adolescent health. And I remember that at the beginning, the chairman of this occasion spoke about one of the core functions of NAMED has been advocacy. And I think this is one thing that NAMED can pick up, advocating for young people, for adolescent health, and for resource mobilization to support the field of adolescent health. The other issue is health promotion, communication, and counseling. Like I just said a few minutes back, that promotion is the key. And thirdly, is that we must provide access to quality services. The fourth is that our young people need to have a safe and supportive environment. The law must support their early development. It must protect them from being exploited, either it's early marriage or any other form of exploitation. We must think about parenting. If you think about the fact that young people don't exist in isolation, but in a social medium, we must think about how do we empower parents to be able to truly guide young people and help them to be healthy. We also must talk about the issue about the health workforce, competent and committed health workforce. The seventh dimension is about adolescent and young people's engagement. You cannot make policy for young people without them. You cannot run activities without them. And so engaging young people, providing them the platform to be part of the agenda is extremely important for us to achieve our aims. And we must talk about research, innovation, and learning. I'm sure that's something Ahmed is particularly very focused on. And we must also think about how do we then ensure accountability on part of duty bearers and all those who are connected with what we are asking to do. And finally, collaboration and coordination, which I know that Dr. Oji spoke about how do we put all this together. Those are the key strategies that the policy believe that doing this will get to the point we want to do. So what's the plan for implementation? If you go back to what I've just said, that adolescent health is not about the health sector, but it's a multi-sectoral, it's a cross-sectoral agenda. Then we understand that we need to pull together actors from different areas. The work of the health sector is to coordinate and to support other sectors, but there are different sectors that must work for us to be able to get to the goal we want to do. The health sector, other sectors, including education, youth, women affairs, social development, sport, and the rest of it. Then the academia to help us generate the data we need. Civil society to advocate and promote social accountability and run community programs. Media to help us educate young people as well as their parents and even policymakers, including also the uniform services. Particularly now we are facing a lot of conflict in Nigeria. We need to think about the young people who are working their forces as to how do we also empower and help them. And Nigeria has so many of those policies, but not just policies. We have already existing a number of materials that we can use to jumpstart this process. And I'm just talking about those that focus on adolescent. I'm not even talking about the broader one. From issues like training manual to those that have to do with clinical protocol, to 2 documents that tell us about how to integrate adolescent services into primary care, and to issues of the national standard that tells us the minimum thing we must see for you to see your adolescent, provide adolescent services. The last 2 are the monitoring evaluation plan that we've just developed at national level to look at how we are doing. And perhaps the most exciting one is the fact that recognizing that we have seen more emergency. They have just developed in late 2022. I was privileged to work with Professor Additional Olumide to develop the new national guideline for adolescent health programming for emergency response, so that in places where we have more emergencies today, we know exactly what to do to improve the life of young people. So in 25 years of doing policy, where are we? We've done well in some areas, and we've not done well in some areas. I don't have enough time to talk about that. I think I must begin to round up in the next few minutes. But to say that there are areas where we need to do more, particularly prevention and scaling up of services, and also training health workers so that there can be more of them. And there are challenges in 3 dimensions. One, the fact that adolescence is a multi-sectoral dimension brings its own issues.
I've muted him.
Please unmute yourself, Prof. Sir. I muted everybody.
Thank you very much.
Prof, please unmute yourself, sir.
All right, thank you. Okay, so there are 3 dimensions of challenges that we need to deal with. One is one that has to do with the nature of adolescent health itself. Because you have to talk to education, you have to talk to social development, you have to talk to the legal, you have to talk to health. That multi-sectoral issue is one area that we have some struggle, but increasingly we are getting results. Secondly, there are multiple partners. There are more than 15, 20 partners, international partners working in this field. And sometimes the tendency is that each partner wants to run his own agenda. But thank God that the National Technical Working Group is stronger and is trying to put them together. The other issue is also, how do we effectively coordinate without causing disruption between the sectors and between the actors? And the second issue has to do with contextual issues. Political context, because health is a concurrent agenda. Federal, state, and primary and local government has a role in that. Sometimes that causes a problem. So we have all these policies at the national, but at many state level, they are not even connected with those policies. And so we need to begin to ask ourselves, how do we get states to buy into the national policies and get local government to become actors in those policy arena. And the other issues about social context, like Dr. Oji said, there's so much suspicion when we talk about adolescent health, so much community upheaval, so much religious upheaval. But we must find a way to overcome those if we want to improve adolescent health. And lastly, in terms of core implementation issues, one is about the primary care. The weakness in primary care system is affecting adolescent health significantly. The fact that many players and many health workers in primary care level are not trained or yet in adolescent health is a big challenge that we must face. And of course, that leads to capacity deficit. There is significant capacity deficit because our medical schools, our school of nursing, all of them are not equipping new workers that are coming out of those schools. They're not equipping them with skills in adolescent health area. And this is an area we must look at, we must deal with to ensure we get results. And of course, poor funding. And I think that these are low-hanging fruit in some ways because we have the platform already said. Number one, we have all these policies and materials, but are they available in our facilities? So the first quick winning point is to make those materials. Many of them have they are self-explanatory. We need to make them available everywhere in our country and to give health workers some level of orientation using a combination of approaches, hybrid approaches, phone-based approaches, and all that. Number two, we must increase the availability and accessibility of capacity building programs. We must integrate adolescent health agenda into all health training curriculum in all institutions that are training health workers across our country. That should not take us a lot to do. Number three, learning from what we have done in family planning over the years. One of the things we need to begin to do is to do a national accreditation program for adolescent-friendly services. That also was done for baby-friendly and when we started baby-friendly initiative, where you can begin to map out institutions, so say they met the criteria. That is going to help stakeholders to begin to strive to make sure they meet the criteria because you already have a minimum guideline that will make you qualify. Number four, we need to improve access of young people to accurate, age-appropriate, and relevant information. And we must use all the available media, including and particularly social media and the new media. Number five, young people are mostly in school, so they are already there. Unfortunately, our school health system is so weak, and that if we can only invest in the school health system, then we overcome more than half of the challenges we face in the country. So we need greater investment in the school health system, connecting school and health, and making sure they work to support young people. The sixth one is that we must strengthen community-based programming. And I'm not talking about some high-falutin NGO work. We have so many churches in Nigeria, so many mosques. Nigerians go to churches almost every day of their lives. The same about mosques. They provide very ready, quick win platforms that we can get them to work to help young people and support them as well as support parents. And finally, we must sustain evidence generation, new level of research, including implementation research, to understand why pathways that we know that work elsewhere are not working in certain circumstances in Nigeria. We need those home-based research to inform us what we need to do more and to use those results, particularly to drive advocacy as to what we need to do at new levels and at various levels. I'd like to quote the Global Strategy for Women, Children, and Adolescent Health. This was from the US Secretary General. He said, by investing in the right policies, the word is right policies, and Nigeria has invested in the right policy, but it must go beyond policy by investing in the right policy and programs. And that's where the weak point is, getting us from policy to program. For adolescents and youth to realize their potential and their human rights to health, education, and full participation in society, we can unleash the vast human potential of this SD generation to transform our world. And I think, and I pray that with the involvement of a very formidable and high-profile network like NAMED, I think it is time for Nigeria adolescent health agenda to gain greater momentum. My colleagues have talked about some of the things that's going to happen in August. We think that's one of the places where we can use the platform to bring stakeholders together to advance the agenda for adolescent health in our country. I want to thank you very much for your time. Thank you very much, Sas and Mas.
Great, thank you so much, Prof. And so now the floor is going to be open. And I don't know, somebody raised this with me when he saw the ads for this program. I was asking, why is there no AYP apart from you? I said, well, I'm representing the adolescent and young people on the program. So I don't know if we have any adolescent or young person on the call, on the webinar today, and you want to say something, I will give you the permission. It will be a fantastic honor to have you say something to us. So anybody, do you have any adolescent here? While we wait for that adolescent, so the floor is open now for questions, for comments, for contributions. I would also just like to add that this is actually the second webinar of NAMED. There was one in 2022. I guess I misunderstood, but this is the very first one in 2023. And it's a pleasure and an honor that we are discussing something so important in the vein of adolescent health. So, okay, so we have Professor Odunkwe. Yeah, please. The mic, the floor is yours. Please, you can unmute yourself, and if you want to share your video, I prefer you share your video so that we can see who is speaking. Yes. So, Prof, please go ahead. I speak, ma'am.
Okay, thank you very much for giving me the opportunity. I'm really happy and glad to be in this webinar. In fact, I think I'm the first person to sign it. Having said that, this is fantastic, I will use the word. Excellent presentation by all presenters. But there's one particular thing that is like a concern to me, and that is all these beautiful policies, because I'm so glad we have so many policies. Yes, and we are developing more. And to me, I feel that most policies produced in Nigeria end up in the shelves, on the shelves. Implementation is poor, and I'm happy the last week I tried to address it, but I have a question. Do we have any structure for M&E of the implementation, monitoring and evaluating this implementation? And what are we also doing with the artwork of the evaluation? Do we have any plans to make sure that all these policies don't just end on the shelves of those that produce them without really delivering the purpose of producing them? Thank you very much.
Dr. Oji, would you like to please take an attempt at answering that, please? Dr. Ejike.
For the question.
Yes, sir.
Yes, it's important for us to have a framework and plan to monitor continuously and selectively evaluate our strategies. This is what some of us that have been in the civil society for more than 30 years of our lives have been saying. Most policies that are developed, dissemination is the first challenge. They end up on the book stands or in the shelves where of the department or ministry that developed them. First, they are not disseminated. Second, there is no monitoring and evaluation framework and plan to make sure that they continuously monitor what has been done. The other issue, when I had also tried to intervene and ask some of the leaders there, so why are we not monitoring this? And then they say, well, it takes a lot of money. And a good example, if you go to the Federal Ministry of Health, so to speak now, to ask, they will first of all start by saying, by monitoring, you have to move out. It's not just sitting in your desk. They don't even have a car. There's no car that is is designated and say this is a monitor and evaluation card that they can use to even monitor things in Abuja as a proxy indicator of what could be happening outside this environment. So I think is something also as a policy. Yes, we're developing policy, but we also have to have a policy framework and plan to monitor all the policies that have been developed. I remember when I was making this presentation, I did say Nigeria does not lack policies. It's the last mile concept. After we have developed the policies, what are the governance structures put in place? What are the other things that to make sure that this happens? So that is the big challenge that we have.
All right, fantastic. We have the honor and the privilege of having a former Minister of Health in our midst who has had a bird's eye view and is the chairman of this occasion. And this is a very, very important issue. Prof, I see you, sir. I'll get to you right away, sir. I'd just like our chairman, Professor Adewale, to please speak to this. What's the challenge with this, sir?
Maybe I should allow Professor Fatusi just a minute before I round up. Professor Fatusi,
all right, sir.
Thank you, sir. I think that's a problem. But one of the things I'd like to say is that in the current dispensation, when it comes to adolescent, that is one problem we not only have identified, but we are tackling in a very strategic way. Number one, as I showed in my presentation, I'm sure I showed it very fast, this new policy, we developed specifically a monitoring and evaluation plan that has also been published and been disseminated. So we are not just doing a policy because, again, we are learning from the past. But I also want to say that while it is true that going to monitor and evaluate can be very expensive, I think that innovation can help us to accomplish certain things with less cost. For example, we now can use our telephones to run, to do data gathering, to share data, to compile data, to do data auditing. And I think that that is one thing we must do. We must not just stay on what we've been doing. Oh, you must always move out, you must always, yes, it's important, but if you don't manage that with technology, it will be too expensive. The third thing I want to say is that the National Technical Working Group, for example, provides a platform for bringing people together and a place for monitoring. In fact, one of the things that the National Technical Working Group in adolescent health is doing now is that we are producing every 2 years. We are producing the state of adolescent health in Nigeria, so that there are data, we are doing systematic monitoring, and therefore we can know where the gaps are and invite stakeholders to then see how we can then address those gaps. Without some of those critical efforts, we won't move from where we are. Thank you, sir.
All right, sir. Professor Adewale, sir.
Thank you so much, Professor Fatusi. Let me really appreciate all our speakers. We've had a very interesting session this evening, and I want to thank the webinar committee for coming out bigly. This is actually their first webinar, but the first by the webinar committee. And as I stated earlier on, they have chosen an important topic that actually deserves serious attention. I quite agree with all the speakers that this country is not short of policies. We have them in abundance. What we lack is what I would call the will to implement the policy. And it actually starts from when we start budgeting. We do not even budget for the dissemination of the policy document. So people prepare the document, they sit on shelves. If you force them, they put it on the ministry website. In fact, when I took over as minister, a lot of the documents were not even available on the ministry website. So the first few months, we decided to digitize these policies and put them on the website. So we need to budget for dissemination, and we need to put serious effort into implementation. As a person, I would definitely recommend that this webinar should be put on YouTube for people to be able to download, especially those who could not participate today for one reason or the other. Let us put it on YouTube so that they can watch it. Secondly, I think we need to really develop what I would call a NAMED policy framework for adolescent health. Short, brief, that will contain the essentials of this lecture, or the lectures and the presentations, with some summaries, something that a policy person can read while flying from Abuja to Lagos or from Lagos to Abuja. Short, easy to read. I will also recommend that the policy document should also put in place an implementation framework. We need a high-level committee that will drive the implementation of the policy. And this high-level committee should go beyond education. I'm happy Professor Fatusi made mention of this. It should involve ministers of health, education, youth and sport, women affairs, information, science and technology, and much more importantly, within the context of Nigeria and facing a reality, the Minister of Finance. If we do not put the Minister of Finance there, no money will be appropriated for it. So, and then we can then have the high-level committee working with a technical working group that will include academia, media, and researchers, and so on, to drive it. I believe this is a momentous occasion for Nigeria to key into the WCA agenda. As I stated in my opening remarks, ministers of education and health met in Congo-Brazzaville. Nigeria had our Minister of State for Education and Minister of State for Health participate at the declaration, and they were there. And I was actually a resource person to the meeting. So it's quite important. When NAMED is keying, this is a good opportunity for us. Let us drive it. I'm not aware any country has done this. And I say congratulations to NAMED. This is the opportunity we require to drive this agenda and move forward. And as stated by Professor Fatusi, the benefits are beyond the triple benefits as is mentioned. Professor Daisy Olumide made mention of reaping the demographic dividend, creating an energized workforce that's educated, that is mobilized. And Professor Fatusi is talking about what do they benefit today, what would they benefit tomorrow, and what would they even benefit the day after through their generation. There can be no better investment that a nation can make than investing in adolescents. Congratulations to NAMED, congratulations to our leaders in NAMED and to the webinar committee. And I want to thank you, Mr. Moderator, for driving this important webinar. Our speakers, they've done a fantastic job. The presentations were fantastic, to the point and succinct. And to the audience, at a point in time, I think we were close to about 100 people who actually actively participated. And for us to still have about 55 into the third hour, I think we've done well. Thank you, everyone. And I say, I wish us a wonderful evening. Thank you.
Thank you so much, sir. So it's time to round up now. Just before I hand over to Professor Ogunbodede to wrap up everything, I think we should do an attendance picture. So everybody should please put on their videos so that we can have a gallery and we can show that Professor Adewale says that this is the first one by the webinar committee, so that we have the very first video by our webinar committee. So let's put up our videos as we take the screenshot. So put on your best face, yes, yes. I can see Dr. Chima Oduko. She was the first person to greet us today. Professor Mapai, thank you so much. Professor Dino for your question. Everybody, so let's take the screenshots. Yes, 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 yes. We've taken the first one, right? Let me save it. We'll take the next one. I know some people are not on this screen, so we'll take that one. All right. File, save. Okay, so let's take the next one. We have to go to 3 pages. It seems we have so many people. Yes, man, and I think that's a good one that we have so many people that have attended. Yeah, so we have the next trail. Oyefabi, I can see you. General, we want to see your face, sir. General, please put on your video, sir. Put on your video, sir. Professor Philip, I can see you. Ayola Ojewusi, I can see you. Fantastic. Nicholas Rui, I can see you. Fantastic. General, thank you so much for putting on your video, sir. Thank you, sir. Thank you, sir. All right, so let's smile. Let's smile for the screen. Let's smile. Smile, smile. Yes, yes. Great. We have that. So let me save it. And one more, the final screen. All right, okay, at the final screen, Osakpe, I can see you ahead, yes. Mwaditu Akoni, I can see you. Benjamin Osaru, I can see you. Oh, the chair, I need to recognize my chair. The chair of ECO 2023 is right here, Professor Kofo Odeyemi. I can see you, man. Thank you so much. Thank you so much for joining us. Abdulmunini Rafin Daddy, I can see you, sir. I can see you, sir. Emmanuel Adepe, I can see you, sir. So let's take it. Let's smile. Let's smile. Good smile. Nicholas, I can see you again. Good smile. Fantastic. Thank you so much. And I hand over to Prof now, sir.
Well, thank you very much, Dr. Adebayo, for the excellent moderation. The chairman will give the last words, but I just want to give information that this is on YouTube and is going to be there permanently. And we're going to send the link to each and everybody who has actually registered for this webinar. And then it will go to all members of NAMED, and we're going to ensure that the product of this webinar is also taken even further than that. We also have a donor. So, and we are appealing to our guest speakers, to also assist in putting things together. So we might be able to publish that also in the journal. Although I've not taken permission from the editor, but I'm sure the editor is also, Professor Anya, who is also, with us, this evening for this webinar. So that's just the information. It's going to be available, like the chairman said. So chairman, sir, over to you, sir.
Well, I've made my closing remarks. I want to thank the president who actually sat throughout the entire over 2 hours diligent presentation. I'm sure the chairman of the BOT is also there, Secretary Named. Thank you to everyone. I wish us a wonderful evening. God bless you.
Thank you very much, sir. Goodbye, everyone.
Thank you very much.
Thanks,
Well, thank you, everyone. Good night, everyone. God bless.
Goodbye. Yeah. Good night.
Thank you.
The secretary said thank you to everybody. God bless you.
So, thanks, sir. It's been a very wonderful evening. Thank you. Thank you, thank you, thank you. I think we can end the session.
Thank you so very much.
Thank you, everybody. We appreciate your participation and we are indeed very grateful.